Welcome once again, friend, to the most commonly repeated one-liners in ENT. Myself, Dr. Naren Singh Chauhan, and today we will be discussing the part 25 of the series. So, beginning with the today's topic and with the question number 1, which says that injury to which artery leads to orbital hematoma. So, during the endoscopic or normal nasal surgeries, which usually leads into the injury to the anterior ethmoidal artery. So, injury to the anterior ethmoidal artery will leads to orbital hematoma. So, this question is very important for NEET PG exams. Beginning to the question number 2, which says that ideal time for correction of nasal bone fracture. So the ideal time is after 1 week, because after 1 week the edema, the swelling subsides, so that we can approximate the fractured part of the nasal bone and plaster it for around 15 to 21 days, so that they can be fixed, approximated correctly. In the presence of swelling, the approximation is not very good. The question number 3, which says that nasal bone fracture is corrected by. So most commonly used instrument, that is the Walsham forceps. Walsham forceps is most commonly used for correction of nasal bone fracture. We have to keep in mind. We'll separately discuss about the Walsham forceps and its part. Question number 4, which says that which nerve is usually damaged in zygomatic fracture. If there is zygomatic fracture, it leads to the injury to infraorbital nerve. We know that the area of the zygoma, the zygomatic area, so which lead to the injury to the infraorbital area, infraorbital nerve. So if you go with the anatomy, you can guess about the answers. Question number 5, which says that craniofacial dissociation is seen in. So in Lefort 3, we have to remember this. Lefort 3, there is a separation or there is a dissociation between the cranium and the facial structures. So in Lefort 3. Question number 6. Most common site of mandibular fracture. This is most commonly asked question in NEET PG exam, and we have to learn it anyhow. And the answer is subcondylar fracture. Which fracture? That is subcondylar fracture is the most common site of mandibular fracture is subcondylar fracture. Going to the question number 7, which says that fracture of symphysis with condyles of mandible is. So this is known as guardsman fracture. That is the guardsman fracture, which is the fracture of symphysis with condyles of mandible. Usually the guards which used to be employed in the Queen's security in England, used for the prolonged standing with a gun, the support of a gun that leads to the fall of the guard directly on the ground, leading to the fracture of the symphysis with condyles of the mandible. That is the symphysis with condyles. We have to symphysis with condyle, which leads to the guardsman fracture. Question number 8. Most common site of leak in CSF rhinorrhea. The most common site is the ethmoid bone. So, this question will be asked in many ways. Then this question, if this is asked that most common site and in option there is ethmoid bone, you have to go with ethmoid. More specific question will be asked from CSF rhinorrhea, will be discussed later on. Question number 8, which says that CSF rhinorrhea is seen in. So CSF rhinorrhea is seen in case of naso-orbito-ethmoid fracture. As we discussed in last question, which says that most common site is ethmoid. So the fracture usually involves nasal bone, orbital bone and ethmoid bone. The 3 bones are involved. So most commonly there is a complex injury, not an isolated fracture of any particular bone. Question number 10. Most common nerve injured in blowout fracture of orbit is the infraorbital nerve. Which nerve? Infraorbital nerve is injured most commonly in the blowout fracture of the orbit. This finishes with the part 25 of the series. If you like the video, kindly share and subscribe, and stay tuned with the channel for much more parts which are on the way. As the NEET PG exam is very near now, we have to stay focused and at least solve minimum 50 multiple choice question a day for easy grasp and quickly solving out the question in the exam. Thank you. Stay tuned.